Doctors, chronic mesenteric ischemia. Okay, chronic mesenteric ischemia, we call it abdominal angina or gut angina. And yes, you can also look out for that patient who has atherosclerosis as well. Good. Now we are moving from the vascular causes to the infectious causes of abdominal distension. And some of the answers can be peritonitis, ascites due to bacterial peritonitis, tuberculous peritonitis, okay, hepatitis, which can be viral or autoimmune, and chronic pancreatitis. So now let's go to the same exercise. What in your question stem will cause you to think about peritonitis? What are the pointers which as soon as you see this, that, and that, should cause you to think, okay, this is peritonitis? What are the things which should cause you to think that this is peritonitis? Doctor, let's go. How will the patient present on history? How will the patient present on maybe physical exam? So free fluid, yes. Rigidity on examination of the abdomen, yes. Garden. So Dr. Jakilu says acute abdomen, but Dr. Jakilu, I'll request that maybe you make it more specific, right? Acute abdomen, make it more specific. Please make it more specific. Yes, it's an acute abdomen, but please make it more specific. Fever, beautiful, Dr. James Asante. Fever. So what are the pointers in my board exam which should lead me to think about peritonitis? Number one, if I have a patient who has board-like rigidity. Number two, if I have a patient who has rigid abdomen, rebound tenderness, board-like rigidity with fever. So rigid abdomen, rebound tenderness, that patient looks very sick. That patient has fever. Think about peritonitis. So someone says fever with abdominal pain with rigidity. Beautiful. Those are the pointers. Okay, let's go to another one. Ascites due to bacterial peritonitis. What are the? It looks similar to the previous one, so I'm not going to belabor the point. If you have somebody who has cirrhosis of the liver, so I'm talking about spontaneous bacterial peritonitis, okay? Spontaneous bacterial peritonitis. This patient has ascites, and then all of a sudden, this patient has started developing fever. At times, they may even develop some altered level of consciousness and all those things. If you have a cirrhotic patient with ascites who develops fever or new abdominal pain, one diagnosis you don't want to forget about in your board exam is spontaneous bacterial peritonitis. And the commonest organism is E. coli. E. coli. E. coli. E. coli. Okay, so you want to know that. Okay, good. What about tuberculous peritonitis? Doctors, let's move on to that one. I'm very happy about the participation in the class today. Tuberculous peritonitis. Tuberculous peritonitis. Tuberculous peritonitis. What are you going to think about? What are the pointers you're going to look out for? You're going to look for somebody with ascites, but also has some night sweats as well, because this is, combination of tuberculosis, and then maybe the patient has weight loss, night sweats, Yeah, so tuberculous peritonitis. Yeah, the patient may be presented as an immunosuppressed patient, maybe has a history of HIV, or the patient has just come from jail where they were overcrowded, right? Those are the pointers. Those are the pointers. Those are the pointers. Awesome, 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 awesome. Someone says chronic cough with abdominal distension plus fever plus weight loss plus nice. I'm very happy that now we are dealing with medicine like it's some, equation we are dealing with. I really like that.